Sean, very good to see you. A really important topic today, 4 ways to address long-term care and medical expenses in retirement. According to Fidelity, the average 65-year-old couple will need nearly $315,000 for healthcare in retirement, and that's not even including long-term care. Long-term care, meanwhile, is very likely 7 out of 10 people will need long-term care at some point, and it is not covered by Medicare. So let's talk through our options. The first would be traditional long-term care insurance. What are the pros and cons here?
I mean, traditional long-term care insurance can work beautifully, Erin. The problem with it, there's a couple of things. One is that we typically only think of getting long-term care insurance when we're too close to needing it, right? As we grow older, we see our parents maybe needing that care, say, boy, look how much it's costing them. We should get insurance ourselves. Well, just if we're in our 50s and 60s, maybe even 70s at that point in time, it's going to be very, very expensive to buy that long-term care policy. I have conversations with clients, Erin, that are in their 30s, 40s, and I say, we should really talk about nursing home insurance. And they look at me like I have two heads, saying, Sean, I got
Yeah,
kids going to college. I'm paying off my own student loans.
seriously. Yeah.
I can't look at this, and so we don't. So the second issue is that it is a use it or lose it scenario. So if you buy that long-term care policy and you end up being lucky, you're one of the 3 out of the 10, and you don't need that long-term care, the insurance company says thank you very much, and they just keep that premium that you paid. So it can be very helpful, but it's expensive. And then if you don't use it, you lose that money.
Our next option is asset-based insurance. I know you're very busy, Sean.
I know, asset-based insurance is similar to long-term care insurance, Erin. In fact, it covers the same thing. It will cover long-term care. What I like about this is if you don't use an asset-based insurance policy, it converts to a life insurance policy. So you get a tax-free death benefit will go to your beneficiaries or your heirs. The second nice thing about this type of policy is it's called an indemnity policy, meaning as long as you satisfy the requirements to receive the benefit, that long-term care benefit from the insurance company, you actually get a check, and then you can pay whoever you want with that money. You could pay directly for the nurse to come in and take care of you. You could pay for a relative to help take care of you. So there's a lot of flexibility in that. And then, of course, if you don't use it, at least somebody will essentially get a death benefit from it. So you don't lose the whole premium.
And next, of course, you could self-insure, but this is difficult and also risky.
It's difficult and it's risky because the cost of care is very, very expensive. For a person to come in and help take care of you right now, it's approximately $75,000 a year. That is going to go up to about $140,000 in about 20 years is kind of what we're looking at. So you have to understand what those expenses are. By the way, that's the cheapest that we just saw on that page. You have to understand what those expenses are and make sure that you have a good plan in place to keep pace with that inflation of that long-term care. It's inflating much quicker than normal goods and services. And you got to make sure you have that money now. And of course, you can't sacrifice your regular retirement income. So you have to make sure you've got both. It's possible, but you have to make sure you have the finances in place. And if you do, make sure you have a good plan.
And then your last option would be becoming a dependent, which is also the reality of what happens if you do not have a plan.
It is. I mean, and this is what happens to so many families, Erin. And we've done this as a society for generations. We take care of the seniors in our families. And, as our grandparents or parents get older, they maybe move in and we help take care of them. But I think we all look at things a little bit differently these days. Families are spread apart. We have a lot of independence, and you might not want to have to rely upon the care of a relative or a loved one, when you get older. Maybe in your family, that's fine. Just understand how that will feel emotionally. Understand what that will be for your spouse potentially. Your spouse may become a caregiver, and I don't know that we all want to go down that route, but it is a possibility, and it is something that families will decide. And if you're comfortable with that, it's an option.
Right. And it's clear that what's most important is having this difficult conversation and creating a plan proactively now, again, before we need that care. So, Sean, if somebody wants to sit down with you and talk through these options, what's the best way to reach you?
Please give us a call here at our office. The number is 603-715-2335. You can also go to our website. We have more information there. You can also put some time directly on my calendar. The address is daviswealthmgmt.com.
Great. Sean, thank you.
Thanks, Erin.